It's February. It's all about the heart. Please welcome Bryce Wylde. We talk about heart health. The number one killer of North America, women in North America. I cannot believe it.
I think it's just something to do with stress being one of the North American-wide silent killers. You know, we got to appreciate and honor our hearts better.
Right.
We now know actually there are more signals that go from your heart to your brain than there are from your brain to your heart. You know, traditional Chinese medicine, I think, has had this right all along, that the heart is the seat of emotion. And when we're stressed out and have all this sort of, you know, we're experiencing, you know, whether it's mentally, emotionally, strain to the heart.
Right.
And unfortunately, annually here in Canada, we're losing about 250,000 years, potential years of life every year. Right? That's pretty sad and shocking.
We're losing those years of life?
People could have lived longer lives had they not experienced a heart attack or stroke.
Oh, okay.
So this affects actually
right.
9 out of 10 Canadians experience some symptom, at least one, relevant to heart attack or stroke, right?
All right.
So whether it's hypertension or pre-hypertension, or, you know, their stress levels are, you know, through the roof, or they're not eating healthy. There's a lot of things that we got to get better control of our heart health.
Yeah, and there is a lot of stress happening, and there's a lot of bad food being consumed because it is absolutely everywhere.
Right.
A lot of people think heart health and they think of the overweight male of a certain age, and that's not necessarily the demographic, and that's the sort of information that has to be changed.
That's right. Actually, tables have turned. The stats have shifted. This is now more of a killer to women than that proverbial, you know, overweight older man. So women should pay attention. You know, this lends and bleeds into statistics around, you know, both how men and women, gender differences in the symptomatology. We got to get a wrap and a handle on that as well, because there is some idea that men and women experience a heart attack or a stroke signs of a little bit differently.
Let's talk about that a little bit.
Let's
so
do that.
some of the symptoms you might want to look out for. If you're having pain or shortness of breath or fatigue, who's going through that usually?
That's actually pretty equal between men and women.
Okay.
So yeah, we want to pay attention to that and not ignore it, but that's a pretty equal statistic.
Right side chest discomfort.
Yeah, this is really interesting. So this is actually about 5 times more prevalent as a symptom in men.
Okay. Throat discomfort, which is something
I
would have never thought of.
Yeah, throat discomfort. Don't ignore this, ladies. It's about 12 times more prevalent in you that you'll experience a discomfort in your throat.
How about a dull ache?
So dull ache is a little bit less, so about 4 times more, but in men. So we describe this sort of a dull achiness. Oh, I feel discomfort, you know, maybe from that stressful morning meeting.
Right, all right. Pressing on the chest, a pressing.
Yeah, a pressing on the chest is more prevalent in women. In fact, by about 4 times.
And indigestion?
Indigestion's more in men, and that's about 7 times more. We describe this sort of this acid reflux heartburn, but it may not just be indigestion.
And then finally, vomiting, which is something I would never think was a sign of an unhealthy heart.
Yeah, 4 times more in women. So women experience this degree of uncomfortableness in their stomach. They feel nauseous and they want to throw up. So these are all reasons to call 911 immediately. Do not ignore it, because here's another gender difference. Yeah. Men may wait up to an average of 3 hours, but women wait up to 4 hours on average before dialing those 3 very important digits.
Because a lot of these symptoms you see based on, you might think it's something else. You might think, oh, I'm coming down with the flu. Or
we just talked about indigestion, or you've had a stressful meeting, or it'll go away. And you know, often you will present to the ER and they'll push on your chest right here. It's called the costal margin, and there may be a little bit of a joint inflammation, but leave that up to an ER doc who's well experienced to differentiate and diagnose for you, folks.
Got it.
Right?
Let's talk about what we can do in terms of our diet and supplements to have that healthy heart.
So what we're looking at here is what we affectionately refer to as sort of a Mediterranean theme. So we've got our olives, lots of fresh fruits and fruits rather. Coffee. I don't want to shun on coffee. I have an espresso every single day. There's reason for that. Yeah. If you're not already a wine drinker, you may want to pick up some elderberry juice. All right, or some blackberry juice. Start drinking that. You don't necessarily need the alcohol. The 1 glass a day for women still revered as healthy, and 2 for men, no more than that. But what we're looking at here is really all these wonderful spices, chocolate. The underlying theme here is called polyphenols. This is the antioxidant found very rich within all of these different foods, and the reason why in Mediterranean areas they live longer and healthier with less heart disease.
So coffee's in that category, polyphenols?
Absolutely. Make sure it's organic, because there's a lot of pesticides sprayed on coffee beans, so organic is far better.
Okay.
Absolutely.
All right, now you've actually done some work in this with the book that you have with Frankie Flowers, Power Plant. So
technically spring's right around the corner, right? So how to grow a lot of these herbs and spices in your home. Doesn't have to be in the garden yet, but to prepare for that, we talk all about how to turn them in to both culinary and very, very healthy remedies for the heart. A lot of the polyphenols found in that book, so thanks for the mention.
We have an easy way to buy that book. Just go to our website and we'll give you a link, cityline.ca. Now let's talk a little bit about supplements.
Yeah,
what
real
might
quick,
you
so
want to have a healthy heart?
So get your diet and exercise right, get that stress lowered, but in supplement world, DHA as an omega-3 is very, very heart and brain healthy, by the way. Here's what's really quick as an interesting factoid. It's found very concentrated in the wings of a hummingbird and a rattlesnake. So our hearts need this to be pumping all day, every day for the rest of our lives.
Really?
Absolutely. Coenzyme Q10, or otherwise known as ubiquinol, that's what you want to look for. If you're on a statin drug, you have to be taking that. Talk to your doctor about it. Statins lower the amount of this very important antioxidant, and therefore replacing it through supplementation is key.
Okay.
Polyphenols. Look for on your label Mega Natural BP. In this day and age, we also have what's called pre-hypertension. Folks that are normal is between 120 over 80, and people that are between 120 and 130 over between 80 and 90 are still suffering from a hypertensive state leading into hypertension. That is a risk factor for heart disease and stroke. So Mega Natural BP is a polyphenol. It's a concentration of what you see here in your diet, and ultimately that you can supplement with, which will reduce your blood pressure and ultimately give you a healthier heart. This comes from grapeseed extract, actually. All right? And so testing yourself, lastly, absolutely look at testing yourself for all these. Your doctor can report on these findings. Go to myhealthreport.ca, and what you can do is beyond what your doctor would typically do. In fact, actually, there was a study just done real quick. The Canadian Heart and Stroke Foundation did this study. 50% of the time, your doc's not even asking you about or checking your blood pressure, whether you smoke or not, how healthy your diet is, or if you're getting exercise. So you need to go above and beyond the system in some cases and check C-reactive protein, glycosylated hemoglobin. These are all things you can do with My Health Report. Bring this to your doctor. Start the conversation.
All right. Thank you.